let's just quickly review this. In the DKA patient, basically, one of the most important clinical manifestations is what? That's what we talk about. One of the most important clinical manifestations with the people with DKA is like dehydrations. And we talked about what can cause and trigger the dehydrations. We talked about that. I also talked about it, that the pH level goes down, so that is going to cause metabolic acidosis. Bicarb level goes down. That is what's going to happen. You're going to have a lot of this acid in your plasma. That's what is going to happen. There's going to be hyperglycemia. So this you can call this as, okay, whenever there's you can call this because there's a lot of glucose, and at the same time a lot of this glucose is you're passing to the urine. Okay, we call that as an osmotic diuresis. Let's just write down osmotic diuresis. It's called osmotic diuresis. Very, very important. So you have hyperkalemia, you have a glucosuria, you have polyuria, frequent urinations. Okay, you have a ketonuria, you have that. You have a hypophosphatemia. You're also losing calcium there too. Okay, you have a loss of blood fluid. You're also giving dehydrations, having a dry mouth. This can might trigger like the vomiting centers. But not only that, it can trigger the vomiting centers, also here, even here too. Like look, because epinephrine, because there's enhanced level of what? Epinephrine is there, right? So those epinephrine has receptors in here. And what they do, because usually acetylcholine do what? Acetylcholine do peristaltic contractions and digestions and all that, right? But epinephrine it's a flight and fight. It does opposite of acetylcholine do, right? So they can trigger here to also cause those vomiting and nausea. That's also happening here. So some of those, okay, let me say one more time. Some of the symptoms that patient of DKA can have is low level of bicarb. From the ketogenesis, the fruity smell, the sweet fruity smell, odor, you see that. You see a small breathing, okay, because of the increase in the, this triggered in those, the respiratory centers. Because remember, the central chemoreceptor, what happens? The protons levels in here, they stimulate central chemoreceptor, and the central chemoreceptor, they stimulate those inspiratory respiratory center, or we can call the inspiratory respiratory group of this nuclei, okay? And that creates what? Increase in like your tidal volumes, and what is it called? And increase in your ventilations, okay? Because you can puff out more carbon dioxide. That one, you're losing lots of water. So whenever you lose lots of water, you call that polyuria. And very, very important, you should always remember, it's about the potassium, hyperkalemia. And I talked about the reason why, there is a hyperkalemia in this patient. So whenever, let's just quickly talk about how do you manage if you have a patient with a DKA and your hospital floors. How do you manage that? Previously, as I said, you do not do any sort of fast treatment. There's no fast. There's no, you never should do fast. Fast treatment can kill the patient. And slow treatment can also kill the patient. And whenever you give insulin, you need to monitor the potassium level. Now, first, there's a loss of fluid. You need to maintain the loss of fluid. So you can give what? Saline management. Okay, we'll talk about, okay, let's just write it here, management. Okay, you can give what? You can give saline, like saline is very, very important, right? Because you have to up the fluid, right? Because the person dehydrated, okay? You have to up the fluid, right? That's what you have to do. Okay, the saline that contains like glucose, okay, that's what you have to give. And then, of course, then you have to give the insulin. Okay, you have to give insulin. And not only that, okay, then you have to maintain these electrolytes too, because there's an impairment with the electrolytes. All those calcium, magnesium, bicarb. So you have to maintain your electrolytes balance. It is very, very important that you do all of that. One more thing that I have to mention is that whenever, like, a lot of water is also going from your muscles and all, your muscles, and also the potassium, this cells becomes hyperpolarized, and the patient may feel very lethargic too. That is also, they may have that lethargic too. Now, I think this is all I have for you guys when it comes to about DKA. And this is, as I said, this is a pathogenesis of the diabetic ketoacidosis. And I think I made it very, very clear to you guys. Please don't forget to hit the subscribe and make sure that you comment, like, and also share. All right, thank you guys.